Hello and welcome to today's edition of Keeping It Real with Rammona. I have a special guest with me today. Her name is Dr. Noopur Jain. Hi, Noopur.
Hi, Rammona. How are you?
Good. How are you?
Very well. Thank you.
Thank you for taking time out for being here today. And I'm
My
looking
pleasure.
forward to an interesting conversation with you. So
Same
I'll just
here.
take a brief couple of minutes and introduce Dr. Noopur to everyone who's watching this now or who might watch the replay.
Hello? Hello?
I am sorry, there seemed to be a technical issue there. I'm trying to see if Dr. Noopur can join us back. Noopur, are you back?
Yeah. Hi.
I don't know what happened. I'm sorry, the stream just seemed to disappear and I couldn't.
Yeah.
So apologies for those of you who joined us. Let me restart. So I have a special guest with me here today, and her name is Dr. Noopur Jain. I'm going to just briefly introduce Noopur, and I hope that the rest of the stream is going to be seamless.
Yeah.
We seem to hit some network issue. So Dr. Noopur Jain is actually the founder and consultant dermatologist of Skinzest, and that is in Gurgaon. That Skinzest has actually been set up by her, and it's one of the leading and most popular dermatologists. She's one of the most popular dermatologists and cosmetologists of Delhi NCR. She's got a very experienced eye in diagnosing and treating not just the common skill ailments that people might have, but also complicated and rare dermatological diseases. She's got very extensive experience and cutting edge research, that she's been doing, and because of that, I think she's got the ability to diagnose and cure anyone who comes to her who may have a bit of a complicated issue going on with them. So actually, Dr. Noopur is from a background which normally you don't see, that there are too many doctors, female doctors, in particular. So we're going to talk about that a little bit as well. But it seemed that she was, fairly young when she decided that, perhaps this was the path that she wanted to take. And she ensured that, that's what she did. And here she is today. She's a doctor and she's doing amazingly well. So she's got an MBBS from Bangalore and an MD in dermatology from NCR. Apart from that, she's actually credited from bringing aesthetic dermatology, eyebrow microblading, and various injectables for face sculpting, which we know these days is very popular with a lot of people, anti-aging procedures, lasers, and hair loss therapies to Gurgaon. One of the things that I liked about her is that, she's someone who feels less is more. So she's not someone who believes in overdoing, any sort of procedures. She will only recommend what is the minimum that's required for an individual to sort out whatever issue that they're having. So I think that's a great thing, because nowadays you find a lot of people, even a lot of doctors, recommending a lot of aggressive sort of, treatments and procedures. She's a very keen learner and observer, and she regularly addresses and interacts at leading seminars and conferences on dermatology around the world. So again, Noopur, thank you so much for being here today. And
thank you for such a warm welcome, Rammona.
Apologize, I'm not sure what happened right in the beginning, but like I said, hopefully the rest of this stream will go well. So I thought, why don't we start the conversation today with you talking about, what was the reason that you decided to become a doctor? At what age do you figure out that's something you wanted to do?
I don't remember wanting to become anything else. Like, even from a very early childhood, somehow I just knew that I wanted to become a doctor. My grandfather, my Nanaji, who just expired this year, he had a huge role to play. Like, he was a huge influence for me. My background is completely, like, my family is completely business oriented. There's not a single doctor in our whole family till far away. But I was so influenced and so inspired from my Nanaji that there was no other option, no other choice that even came to my mind when I was deciding about my career.
Okay, so what is it that your Nana did that inspired you so much?
Probably like the kind of work that he did. Like, he was very dedicated, very compassionate, and in return, the kind of respect he got from society. Probably those were the things which really inspired me. Like from the very early years of my childhood, I was living with them for a very long time. Like, I spent 2-3 years of my initial childhood only with them. So probably, that's when it got inculcated.
Wonderful. How lovely to have a grandparent that, influences one, and, one is inspired by a grandparent. Thank you so much for sharing that. I think, more and more with families becoming, nuclear, and the family divisions changing, in India, not just in urban areas. You start finding that in rural areas also. I mean, I think it's fortunate if, we've had opportunity to be close to our grandparents and have them around. You see much less of that, around you more and more. Because,
it's
a lot
blessing.
of people are...
It's a blessing. Yeah, it's a blessing to have grandparents and to live with them. Just watching them day to day, that there's so much to learn.
Yeah. So I don't really want to get into too much about, like, particulars in terms of backgrounds, but I know in a conversation we had, you did share with me that you're from a particular background, and so maybe you want to share that with us. Why is it not a common thing for, girls to be working or girls to be doctors in particular from, your family background?
So, I come from a completely Marwari background. So, in our family, until years back, now at least, definitely things have changed. But when I was younger, the concept of women studying or being professionals or working outside of home was very uncommon. So definitely, it was a big change. It was a struggle to convince my family that this is what I want to be. This is what I want to do. Like, even living in a hostel level by myself, or living in a PG while I was doing my medical studies, that was also something which was a struggle to convince them about.
Yeah, I mean, I can understand that, because sometimes, parents want to be very protective of us, and you said, perhaps in particular with your family background, it wasn't really the norm, for a girl in particular, or even boys, I guess, because again, like you shared in the beginning, your family is business oriented, so that's kind of maybe what one would have expected. Maybe you branch out into like jewelry design or something, but not really the medical field. So, I'm really proud that you had the courage to make that decision that that's what you wanted to do, and you stuck with it, and you're doing something that you really like doing today. So that's commendable. I think that's very encouraging for a lot of people who might have that struggle, with families and not just for a woman, it can be for a man too, because in certain families, if you're from a business background, that is the transition. Maximum you'll be involved in the family business, or you're going to set up, some business of your own. So, I commend you on being a brave lady and making that decision and sticking to it. Because sometimes it can be
the sticking is the most important. Yeah, the sticking is the most important part, because there were so many times where you really want to just give up and think that why am I struggling so much? Why? Because medical studies is of course one of the most difficult studies, and in that time, so many times I felt that why am I going through all of this? I have an easier way out. But I mean, it took a lot of effort, like sticking that was required.
Yeah. Wonderful. So I have a comment here from Sunanda. She says, well done. So I guess she was responding to the conversation we were talking about, coming from a particular background and then saying, no, this is what I want to do. So you mentioned that there were some, tough moments, when you were studying. What was the hardest part? Was it, being away from home and the comforts of home, or was it just the sheer, amount that's required to become a doctor? What was the toughest part for you?
I think the studies were the toughest part. To be honest, Rammona, I've been very lucky, very blessed. My uncle, he stays in Bangalore where I was doing my MBBS. They were a huge support for me. Like they were like, they are like family to me. Like we are almost, we are very close. So I never felt that I'm away from family. Even when I was staying in a PG away from them, they were always there to help me or support me in every possible way. So that ways I would say that I'm very lucky and very blessed. But I mean, definitely the medical studies, the exams, practicals, internship, it all of that is probably the toughest.
Yeah. Okay. Dr. Jain?
Yeah, I'm here.
Yeah. Okay. Yeah. So, I understand. I mean, it can be a very long and arduous journey. So I think, a lot of times in life for different things, we need to stick it out, and, we need to have that courage to just stick it out and, pursue whatever it is that we would like to do. So I'd love for you to share more about, how you went about Skinzest is, your baby, and you set that up a few years ago. So I'd love to know more about, why did you decide to set up an independent practice, and how's the experience been for you?
So after I completed my MD, my husband was doing his super specialization from Jaipur. He's a plastic surgeon. So I went and moved to Jaipur with him. I had just delivered, like right before my final MD exams. I had just delivered. So
you just had a baby?
A small baby.
Oh wow! Okay. All right.
I mean, if you ask me the toughest, that was probably the toughest time when I had a feeding baby and I had to go to college and and then prepare for the exam. That was probably the toughest time for me. And
I'm sure.
So once I was done with that, I shifted to Jaipur with him. With the small baby, I still didn't want to stop working. So I was still associated with 2-3 hospitals in Jaipur. I even started my practice over there in a very small scale, of course. But then we moved to Gurgaon about 4-5 years back. And here, I was associated with different clinics, different hospitals. But 3 years back is when I started Skinzest full time. And it's been an amazing journey. Like the satisfaction of having your own practice, having your own clinic, is a different level. Like I never got that while working at the hospitals.
Okay, wonderful. So I didn't know that part, that you just shared, that you actually had to give your finals and you had a newborn baby or a small baby. So more respect to you for that, and thank you for sharing that with us. So what are the main focus areas for you at Skinzest? What are the focus areas?
So we are definitely, of course, treating all skin-related problems, skin and hair-related issues. But
Yeah,
my whole aim is to be able to bring the latest technology, latest treatments at affordable rates for the clients, because patients, they have this notion that laser to bahut expensive hoga, and injectables, filler, they are not for us, they are the upper class people. But it's a wrong notion. Everyone has to undergo aging, so why not do it gracefully? Why not look the best version? So that's what we strive for at Skinzest. My husband is a plastic surgeon, we both work together, so we try to give the best possible solution, giving
yeah.
the patients the most natural results, and with of course, the latest technologies and the latest research.
Okay, all right. So, I talked about the fact you are someone who recommends or, talks about less is more. There's just a comment here from Kamal. She says, very brave, more power to you. So I
Thank
thought
you.
I'll
Thank you,
quickly
Kamal.
share that. Um, so you so you said that, I shared that, you believe that less is more. Do you have clients that come in who want a lot of, treatments, or very aggressive treatments, and how do you handle that if you feel it's not in their best interest? How do you handle those
I'm very
situations?
open. I'm very open with my clients. If I feel that something is not right for them, I say it to them outright. There are definitely lots of clients who come. They get one filler done and they say, "Ki now this part also I want corrected," or this also I want improved. If it is doable, and I feel that that is definitely going to improve how they look or help them, I will do it. But if it is something which is not going to, or which will make things worse for them, then
Yeah.
outrightly refuse.
Okay, understood. So, Dr. Nupur, I just want to talk about something with you, which is the fact that, there are two schools of thought. One, of course, you being a dermatologist, I totally understand that, this is the work that you do. And, you've talked about fillers, and, you've shared that your husband is a plastic surgeon. And that's also very important work because, there are times, certain procedures are required, for people. But tell me, what about the fact, well, I mean, like I said, not the fact, but maybe two schools of thought. One says, be your natural self. And the other school of thought is, yeah, if you need cosmetic procedures, or you need, to go down a route where you require, say, fillers or Botox or whatever. What is your, take on that? Because, sometimes I've found, over the years that there are individuals who are kind of, I don't want to even use the word obsessed, but maybe that is the correct word, about how they look. And then it becomes a problem. It's not just like, I'll get one procedure done. It's going to be one, then it's going to be another, then it's going to be another. And, you hear some stories about, things going wrong for people who walk down that path. So tell me about that. What are your personal thoughts on that?
So I completely agree. There are two schools of thought. But over the years, what I've realized is, when you look at the mirror, if something bothers you and you get that corrected, the amount of self confidence gives you, and you start feeling much better about yourself. That is something which is a blessing, I would say. If it is
Okay.
something that is not required, or you're just getting it done for the sake of it, then I agree with you that probably we should not touch it. We can think of it from the perspective that how we exercise or we do yoga or whatever for our fitness, right? To make our body physically fit. Similarly, these treatments are, most of it is to keep your skin fit. It's like maintaining your skin health. If you talk about fillers basically with age, our skin tends to sag. There is a loss of collagen. There is a loss of subcutaneous fat. With fillers, we are just trying to lift up those ligaments which have started sagging and build up the collagen. It stimulates the internal collagen to keep working. So that is why I would say that it's like a maintenance that you're doing for your skin.
Okay, interesting way of putting that. Thank you for sharing that. So you're coming totally from the scientific space.
Absolutely.
So I can respect that. So Sunanda says, I want to come in for my skin and it's looking terrible. However, a little worried about the COVID situation. Will it be safe to come in?
We are following all COVID-related precautions at Skinzest. Everything is sanitized every day, even after the patient leaves, after the procedure, every equipment is sanitized. So absolutely nothing to be worried about. Sunanda, you're most welcome to come.
All right. Anshul wants to know if you can suggest some treatments for getting a good glow.
We have lots of them. But usually I recommend them based on your skin type and your skin issues. But we have a lot of medifacials. We have lasers. We have this new Hollywood facial that we just introduced called the Fire and Ice facial, which has amazing results. It gives a very nice instant glow. So you can try out whenever you're comfortable.
Okay. And are there any tips that you'd like to give, for those who might not be brave enough to come in for a treatment right now? Something that people can do, something simple that they can do to at least, take care of their skin in the meanwhile, till they have the courage as the situation gets better.
Most importantly, please don't skip your sunscreen, because a lot of people think that we are at home during this whole lockdown or during this whole situation. There's no need to apply the sunscreen, but that's not true. Sunscreen is still important for you because A, you're constantly exposed to the screen, and B, some amount of sunlight does enter our homes even if we are inside. So please don't skip your sunscreen. Make sure that you're applying it on a regular basis. Apart from that, follow your usual cleanser, toner, moisturizer routine. You can start using serums depending on your age. Post 30, you can start using vitamin C serums to help in rejuvenating and giving you a nice glow. You can try certain home packs, home remedies also, but these home remedies have a limitation. They can only perhaps help in maintenance, not so much if you have any particular skin issues.
All right. Thank you so much for those tips. So Anshul is asking, have you got any treatments done to yourself, Dr. Noopur? So you have to reveal your secrets today.
So, Achal and Rammona, I always try out the treatments on myself before introducing them to my patients. Whether it's a new peel, whether it's a new laser treatment, or it's a new facial, whatever it is, I always try it out. So I guess that's what helps in maintaining my skin. Otherwise, I really don't get the time to do more than that.
Okay, great. So you actually try it out yourself to ensure that it's going to benefit your clients. Okay,
exactly.
Wonderful. Good to know. Okay, there's Sandhya here who's saying, please suggest some treatment for hair fall.
Okay, hair fall. First, actually, we need to understand what's the cause of the hair fall. If there's any kind of deficiency or any kind of hormonal issues like thyroid, because that would need the treatment as well. For hair growth, definitely medical treatment like the hair supplements and minoxidil that need to be started. But there's a treatment called PRP. I'm sure you would have heard or you would already be knowing. It's platelet-rich plasma therapy, in which we take your own blood cells and we separate growth factors from it and we directly inject it back into the scalp. So that way, we are taking your own growth factors and giving it directly at the level of the hair follicle. So that really stimulates the hair growth, and it's absolutely safe because it's your own platelets which is being used.
Okay. So, Dr. Noopur, I wanted to ask you something, since, skin related and hair related questions came up, and I work in the holistic healing space. I want to know from you, I'll share what I feel as well, but I wanted to ask you, what do you think? I mean, of course, it can't be a general thing for everybody, because, some specific issues may be caused because of, certain deficiency and stuff. But, do you feel that things like stress or depression play a role in hair fall and issues with skin? What's your opinion about that?
They play a huge role. Your skin, your hair is actually a reflection of your internal health. So, even the diet that you take, that also majorly impacts your skin and hair. So if someone has depression or if someone has undergone any kind of stress, that will directly show on your skin and also lead to hair fall.
Yeah. I mean, in my work, I've seen that as well, that, a lot of things,
Exactly.
that not just hair fall and skincare, but, or skin issues rather, but a lot of other diseases first get created in the mental and the emotional space, and then they, manifest on the outside. And I think that, is true for hair fall and skin issues as well. So sometimes, those are things we also need to look at closely, Tell me something like during the lockdown period. I know that, you are back, at work, and you're seeing clients and you seem to be fairly busy with your work. So those few months, perhaps when the clinic was closed, what was it that, you were able to spend time doing?
Spending time with my kids. I think like I had a great time, really enjoying with my kids, because I don't think me and my husband, we ever got that kind of time to spend, apart from probably the vacations that we used to take, 5 or 7 days or 10 days vacations. Apart from that, we've never been able to spend that much time with our kids. So that's definitely something which I really enjoy doing. Apart from that, I did start cooking. Which is something I had never done. So that was another new thing which I did. And and I mean, online consultations were on. So I was keeping
online
busy with
consultations.
That as well.
Okay.
Yeah.
All right. And so was that something new? I mean, in the past, have you done online consultations or not really?
Very few. There are a few of my patients who are living abroad or who are out of the city. So I used to do online consultation for them, but now it's much more, of course.
Yeah. So Sunanda's asking a question. She says, I've had an allergic reaction from walking in the sun and my skin is inflamed. Please suggest the next course of action.
I would suggest we can do an online consultation, because I'll obviously have to take a look at the rashes, and then accordingly I would be able to advise. Meanwhile, just avoid going out in the sun for now.
Okay, that's sane advice. So I was wondering if you'd be willing to, share maybe, some incidents, or some requests that you've got from clients which, have been a little challenging, and how you handle them.
So there have been a lot of challenging cases. One that comes to my mind right now is there was this patient who was getting fillers done from me, and I told her that this is it. We did her lips, we did her under eye area, but she still wanted to do more. I told her that this is, let all this settle, then we'll plan. But the way she was insistent that no, I want to get it done. I need to get it done right now. So that was a huge challenge to counsel her why she does not need it and why she should wait. Because once we do any filler of any part to get for it to get normalized, it takes about 2 to 4 weeks. So she wasn't ready to wait,
Okay.
because if we over inject, then the results are really bad, and I never want to do that for my patients. So that one I remember. And yeah, there were
Okay.
I do this eyebrow microblading, which is like a permanent, semi-permanent eyebrow that we draw, eyebrow tattooing,
Okay.
which
Okay.
looks very natural, gives a very natural result. So I've had 1 or 2 patients who would hold the mirror while I'm doing the procedure and, actually guide me that make a stroke over here. Now you make a stroke over here, because they are so
Okay.
particular about how their eyebrows are looking. So, yeah, those are a few of the
Okay.
challenges.
Interesting. So they want you to be the doctor, but they want to be in the driver's seat, huh?
Yes, yes,
Interesting.
yes.
So the microblading you talked about, is that something like for individuals who've had hair loss around the eyebrows, or is that for anybody who is keen to get
Anybody who
the
has
shape?
scanty eyebrows, who is not happy with the shape, or who needs to use eyebrow pencil on a regular basis, then this is a wonderful treatment
Yeah.
option for them, because once you get it done, it
All right.
lasts you for a fairly long time, like for at least 1 to 2 years. So
I see.
I mean, yeah.
Okay. I also understand that you do something called non-surgical facelifts. So why don't you share a little bit about that? What are those?
So non-surgical facelift is basically an anti-aging procedure for sagging skin that we do, and it uses a combination of Botox, fillers, threads. It totally depends on how the skin looks right now. So we try to, we can give you a well sculpted jawline. We can lift up the cheeks. We can fill up the hollows on the temples or the under the eyes, and with the threads also we pull up the sagging skin, the ligaments which have become loose. We pull those up. So usually it's like a combination of different modalities. And along
Yeah.
with that, we do microneedling radiofrequency, which basically helps in stimulating your own collagen. So it's a machine treatment that we do, and that stimulates your body to start producing collagen to
I think we lost Dr. Jain's voice right there. I'm just going to wait for her to rejoin us. There she's back now.
yeah, yeah, yeah. Hi.
Yeah. Hi. Okay. Thank you for the information. So Sunanda's asking, has Anchal had any treatments lately? Her skin was glowing the other day. And there's another. Let me just share her second comment. So she thanked you. I think you had responded to the issue with the skin that she shared about being out in the sun. She says, "Oh no, she'll get in touch." And also share Anchal's secret.
Well, I can't tell my client secrets.
I love that, Dr. Jain. Thank you so much for maintaining your client's
Yes,
confidentiality.
yes.
It shows what a good doctor you are. So I was actually not putting that comment up. She had made that comment a while back, and I didn't
Okay.
put it up. But then when she asked again, I said, "Let me see what Dr. Jain is going to say." So I have great respect that you respect your client's privacy and you're not
Of
willing
course,
to
yes.
divulge any secrets. So if anybody wants something different with their skin, they can go ahead and get in touch with Dr. Noopur
Yes.
Jain. I've shared all the information on this post itself. And there's Pratibha Pandya here who says super. So tell me something, Dr. Jain. I was wondering, when you look back, on your journey and the decisions that you made that brought you where you are today, uh, what what are the first, few thoughts that come to your mind?
I'm filled with gratitude. I'm thankful for the entire journey, because, I mean, of course, there have been lots of obstacles, there have been lots of ups and downs, but the downs have never been actually downs. They have been stepping stones. Like every single thing today, when I look back, and I mean, I do have a long journey still ahead of me, but whatever I have undergone, all the experiences, they have helped me reach where I am today. I'm at a place where I'm happy to wake up and reach my work. So I think every part of the journey has been amazing.
Wonderful. So Pratibha says, my skin's become perfect and glows, all thanks to Dr. Noopur Jain. So I think you have
Thank you.
some people who, obviously availed of, your expertise, and they're very happy with it. So what have been some of the most challenging things for you? In particular with setting up your own practice. Maybe we can talk about that.
Uh, one was like I can tell you from the recent past. Like we were supposed to shift to a new clinic in March. We had finalized everything, but because of some issues, the previous owners were not moving out. So I was definitely very disappointed because I was looking forward to starting the new setup. But the whole lockdown happened in March, April, May, June, everything was shut. And I was actually thankful that I'm so glad that I didn't shift in March. It would have been an extra headache, extra, stress for me to maintain that other place, obviously pay the rent also. So,
Yeah.
at the end of the day, whatever happened, happened for good, I would say. And
Okay.
apart from that, I mean, I honestly don't look at them as obstacles. I just look at them as like learning experiences and stepping stones.
Okay. So what's ahead for you? What are your plans for the future?
We are still in the growth phase. I'm enjoying every single day. We bringing in new technologies, new machines. We are just about to finalize another new machine for our clinic. So I think next 6 months, 1 year is going to be very exciting. Doing all sorts of cutting edge technologies and treatments. That's something that I'm looking forward to.
All right, wonderful. So thank you so much, Dr. Jain, for being here today. And before we end, we're in the last few minutes of our conversation. I want to ask you, like I said, I have respect for you that, you had a dream of becoming a doctor and you stuck it out and you did whatever it took, to get there. Is there something you'd like to share with people who might watch this now or later, who, might have certain dreams or might have certain ambitions, but it could be because of any reason. It could be something to do with the family, it could be something to do with finances. For whatever reason, they're not sure if they can really get there. Do you have any words of advice for them?
You need to imagine, you need to really see what you want to do, you need to have a vision, visualize it every single day. Like I will tell you from my experience, I have visualized this clinic where I'm sitting in my dreams so many times in the past few years, and to be actually sitting here and having this conversation and telling you all of this, it's a blessing. So whoever has these kind of plans or future plans and they are still doubtful, just start thinking positive. Whatever message, whatever you're thinking in your mind is a message that you're giving out in the universe, and that's what universe is going to give back to you. So think positive, be optimistic. I'm very grateful again, for my family, my in-laws, my husband. Everyone has been so supportive, has been so amazing. So I think being grateful is something which everyone should like. Gratitude is something which everyone should practice on a daily basis. That really helps.
Yeah, I think one of the things you talked about is interesting, and I totally resonate with it, which is about what is it that you're telling the universe, because I really believe that whatever you're vibrating at, that is what the universe gives back to you. So if we only
Absolutely.
vibrate fear and doubt and confusion,
Yeah,
we
and
just
that's
see
what we
more
get
of
back.
that. Yeah.
Yes,
Yeah, so I think that's
I
very,
agree.
very good advice, and I totally resonate with it, and I'm sure that's going to be helpful for a lot of other people. So thank you so much, Dr. Jain, for being here today, and I wish you all the best. And again, thank you for being
Thank you
you,
so
and
much,
thank you
Ramona.
for thank you for choosing your path and sticking it out and doing the wonderful work that you are, and helping a
Thank
lot
you
of
for
people
inviting
along the
me.
way. My pleasure. Thank you for being here today. Thanks. Take care.
Thank you.
Bye
You
bye.
too.
Bye.
Bye.
Bye.